Hello to everyone who's tuned into PT World. May you be in Pakistan or somewhere in South Asia or probably Africa or Europe or wherever you are. Thank you very much for tuning into PTV World. Yes. I'm Shazad Khan, and with me I have got stunning Maha Makhtoom. Hello Maha, good morning.
Good morning Shazad, how are you?
I'm absolutely
You're
perfect.
very animated today.
Yeah, I'm very jubilant of the fact that it's going to be Eid tomorrow, and I'm very happy about it. And then other than that, one main reason of me being so happy is that unlike any other channel, unlike any other show, we're not doing a show on Chandra or what's going to happen with all those goats and stuff, because we have got something really important to talk about, and that is...
we are actually going to talk about International Ataxia Awareness Day. This time last year, we actually had a show on this, and we were one of the first shows ever to actually talk about this illness, disease, which is very rare, and actually a lot of people don't know about it.
Yeah, and picking up on this, as a matter of fact, the International Ataxia Awareness Day is on 25th, which is tomorrow, but we'll be doing each shows since everybody knows. So what we have done is that we are doing a show one day earlier or prior to the day actually it is supposed to take place on. But the only reason is that most of the majority of the people out there, they do not know what ataxia is, and even the doctors, they do not know whether to come up with the notion whether it's a disease or it's something which leads to a disease. So today we have got somebody who's suffering from ataxia as well, and then we've got doctors. We'll be in conversation with them to let you know.
Absolutely. And before we do introduce our guests, I'd like to say that, you know, last year when we did have this show, there were 14 registered cases of ataxia. Now, over the course of the year, it has now increased to 50. It's an unfortunate increase, but the fact is that people who were already suffering from ataxia now know they're suffering from it because the awareness isn't there. And one more thing I'd like to point out before we start the show is that internationally, so little is being done that, and because of the medium that we use in English, we're able to reach people all across the world. And actually, we had a mother write in to us from America, and she's got 4 children who all suffer from ataxia. So she found that the program was useful, and it gives you support knowing that other people are there, with you.
And I literally feel proud of the fact that we have taken this initiative, being, being affiliated with the government sector as well. So it's not that the government's not doing anything to spread out awareness, but then on the other hand, individuals are doing quite a great job with coming up with such organizations who are spreading awareness about ataxia as well.
Exactly.
So without any further ado, I think we must, start our conversation with our guest.
Yes, absolutely. So besides me, we have Haji, Babar, Naseer. He is an ataxia patient, and you were here with us last year. Welcome back.
Assalamualaikum. Thank you. Good morning.
Thank you.
Walaikum assalam. Thank you very much for coming over, Babar Sahab.
Okay, besides Babar, we have Aftab Hussain. He is a clinical psychologist, and you're also running your own, you work in rehabilitation, addiction. Thank you for joining us. Assalamualaikum.
Thank you.
Besides Aftab, we have Dr. Mansoor Iqbal. He is a neurophysician. Assalamualaikum. Thank you for joining us.
Thank you.
All right, so getting started with the conversation, I think first of all I'll move on to Haji Babar Sahab, since he's a patient himself and he's been suffering, and it's an up and down type of cycle, because earlier his family left him, and then it was a reunion of his wife just because he was suffering through this disease, and then his parents do not interact with him. These are all the odd reasons of what goes wrong with all those ataxia patients. But other than that, how has been your life?
So tell us your story. For those
first of all, I would like to tell you that I am very proud of that my one of friend from UK tell me that PTV is the only national television broadcast in the world who highlight autoxia disease.
Thank you very much for that.
That's a very good news for you, and I appreciate you, all your team, especially in the Bill Bhai and you and PTV. They encourage me to highlight.
Thank you very much for this. But Baba Sahab, what we're going to do is that we're going to share a report on ataxia, and then when we're going to come back, we'll listen to your story. How did you actually figure out that you're suffering from ataxia? And then how did you make yourself aware and all others around you as well? So we're going for this small report. When you guys are going to come back, we'll be in conversation with our panelists. Don't go anywhere. Good morning.
What is ataxia? Ataxia is a debilitating illness which affects a person's ability to walk, speak, see, and swallow. Ataxia has no prejudice. It affects both young and old, rich and poor, men and women. Ataxia can be inherited, but it can also affect someone who has no family history of the disease. Ataxia is life-altering, and many will lose their fight prematurely. Yet one of the most frustrating things about ataxia is that very few people have heard of it. So those that have ataxia spend a lot of time trying to explain what's wrong with them to everyone else.
Welcome back, everyone. And that was a report on ataxia, just to give you a little bit of information before we get Babar's story. So, Babar, tell us, so what happened?
In the 2007, that year after the marriage, of 1 year, suddenly I have speaking problem. Everybody say what kind of I'm talking. People think that they distorting your speaking, but I couldn't judge myself because I think I'm saying right. I had no problem, but the people think that something they are seeing they are changing. After 1 year, 2 years, my walking problem also disturbing. It's just like people say it's just like you drunk people.
All right.
When
So
they
you
are
used to walk
talking
like
or
that?
walking.
So people thought you were drunk or something?
Yeah, so it's a very big problem for me because at that time I'm in the family business, so I could not understand what I have. Suddenly the problem. So because then I got so many doctors, no doctor diagnosed me correctly. One of my friend doctor, Dr. Sayyatanti, he is a general surgeon normally, but he is not an nurse in physical because this field is belong to
related to
nurse
neurophysicians,
physical.
yeah.
But he is a general surgeon. He just opened the iPhone and just put some time. In that time he tell me that what the disease I have.
Okay.
So that day I know that I have a doctor. Before that I don't know.
Okay, so now what did you do once you found out? Like, how did your family react?
So after that, when I know that I have a doctor, I tell my family. So, but they, due to lack of education, my family they couldn't understand, couldn't manage. So, but time by time, it's a great problem.
Okay, but then obviously these problems must have been there just because of lack of education. But then at the same time, what I want to know is that before going to a doctor or to a surgeon, did you go to faith healers as well? All those faith healers, all those Babas or Peers who actually do their treatments with all those spiritual activities. Did you go to a few of those people as well?
No.
No, you
no,
didn't.
never.
So you primarily focus on medicine?
Yeah.
Okay,
Fantastic.
very nice. I think you did
Okay.
a great job in the first place.
Great. Okay, we'll get the rest of the story because your family struggled to manage with it. Okay, so now let's move on to Dr. Iqbal. So give us, we had a report on ataxia. Now you've heard Babar's story. So going forward, what is it exactly and how can we make people aware about it?
So, ataxia, as per se, it is a manifestation of an underlying disease.
Okay.
So, but the problem is that most of the people don't know, even doctors don't know, and there are only 180 neurologists in Pakistan
Okay.
who are dealing with this.
Okay.
And most of the time, the persons go to other doctors and they are unable to diagnose something.
Okay, we'll talk about that. But what happens when we say that it is an underlying disease?
So
what are we trying to
I'm
say?
going to explain. So that's the reason I think Babar had to suffer a lot
Yeah.
before being diagnosed.
Okay.
So in ataxia, it refers to disturbance of balance
Yes.
or clumsiness. So it may involve the gait, the posture, even the speech. When he speaks, that it is unstable or it looks like the patient is drunk.
Okay.
Slurring.
Slurred. And
Yes,
when
that's why
the
I use the word
patient
drunk.
walks, he sways from right to left, so he cannot walk properly.
Okay.
Right.
Okay,
this
but
is-
whenever we speak of it, is it because of the number of neurons are getting lesser in your head, or is it because of some other reasons?
No, it is because of there is a part in the brain which is called cerebellum at the back of the brain.
Yes.
Yes.
So when the damage affects that portion of the brain, you get it. This is one of the reasons.
Okay.
Other reasons which may be acquired, there are many like deficiency or excess of some metals or nutrients. That can also lead to ataxia, like alcohol. So a patient who is having alcoholism, and he may be having ataxia, and deficiency of some vitamins, that can lead. Here, these are the important ones because
What
they
type
are
of
treatable.
vitamins
They
are we
treatable.
talking?
Okay, so how do we know though? How do you know if there's a deficiency or an excess of vitamins? How would anyone know?
No, then you have to consult a doctor, and
Yes.
he is going to do examination and some tests, and he may
Okay,
be able
so
to
what are
find
these?
out.
Okay, now so then what are the symptoms that someone would have, these underlying effects you're talking about, and then they should come to you? So what would they be suffering?
Before you start swaying, before you know you don't know how to speak or something of that sort
what are
happens
these
to you, what are those minor details?
Minor, that like incoordination in the movement. So when you are going for picking a pen or like that, and you overshoot or you undershoot, so you cannot do it properly. So these are the minor signs.
Okay, so that's one. What is another sign?
And if you have frequent falls, then that could be another sign.
And then is there a cure for this disease, or you can just curtail it within some parameters?
Yes, regarding the inherited forms, which maybe in this, Mr. Babar is having, we have just physical therapy and rehabilitation.
Okay.
Which psychologists can be involved, physical therapists can be involved, speech therapists can be involved.
Okay.
These are, and plus social rehabilitation. Regarding the other ones, we have medical treatments like which are required due to deficiency or excess, and they are mostly curable.
Okay, so it can be curable.
Yes, we not a whole of the ataxia.
Okay.
Some forms.
The forms. Okay. Now, let me ask, Aftab, you're a clinical psychologist. Now, the psychological damage, or the damage to the brain, can you slow down the damage that's happening, or can you regenerate it? What's happening?
First of all, I would like to thankful to PTV that would join us with the combination of doctors and psychologists to treat and aware
Thank you. Pleasure's all ours.
people.
Okay.
There is a comorbid condition in ataxia and other physical problem. Babar is also my patient. He's suffering from bipolar disorder too.
Okay.
He's been treated like 3.5 years ago, and he is also in contact with me. There are so many patients who not because in ataxia, patient is not freely move in the society.
Yeah. So you have to be careful.
Yeah, exactly. He developed the feeling of worthlessness, hopelessness, and other psychiatric symptoms. We would like to come forward and just to prevent the disease of ataxia and bipolar disorder, because there is a lot of damage in ataxia and depression. If someone,
Yeah, you go ahead.
if someone is suffering from ataxia or other physical illness like HCV and HIV, he also has a tendency have a
Of course.
psychiatric problem.
Okay.
So there needs to be a management of
Yeah,
everything.
exactly.
No, but what are the commonalities in between ataxia and bipolar disorder as well?
Bipolar disorder is basically it's a psychiatric disorder in which two poles are there. Bi mean it's mania and depression.
Yeah.
Babar was suffering from mania. Most of the time he was irritable and lack of sleep, and sometimes he become very aggressive, lack of sleep, and these kind of symptoms. His family came to me and reported all the symptoms, and after a while he got admitted to me about 3.5 months. And
That's great.
yeah.
Okay, so that's the thing. So, so basically, there's no link. It's the fact that when you get a serious illness, then you are more prone to
Exactly.
psychologically. you're
But
more
I
prone
think
to illness.
it might all start from depression. Depression might be the first step ever as well. I mean,
No.
even if we speak of Alzheimer or Parkinson, depression is one of those things which plays
Aspects,
a
yeah.
very
But the best
plays a
difference
very
isn't.
deep-rooted role as well.
We need
so,
a psychiatrist for that.
so, Dr. Saab, if for example we ask you
yeah,
about this,
you could tell us.
since you're a neurophysician as
Can
well.
depression trigger, or can it
towards-
mental illnesses
we
trigger?
cannot label it because there are no well-controlled studies
Okay.
which have
Okay.
shown that this can lead to this. But
Okay.
these diseases, obviously, they lead to psychiatric disorders.
Yeah.
Because patient cannot walk, he has
Exactly.
difficulty in doing the normal tasks. So he
So let's
develops
move
it.
on to Babar Saab over here. So Babar Saab, when initially you had trouble in walking and talking to other people, so what were the feelings you were going through? What were your emotions back then?
When I'm talking to people,
No, but earlier when you had difficulty in doing all of this.
the first of all, the main difficulty of speaking, understanding, if someone called, if someone is call me, or I'm talking to other person, just like I'm talking to you. You know, because I regularly in touch with you,
Exactly.
so you understand. But the first time the person met me, he cannot understand my language.
Okay.
He first would think what the person have, something is just like this a person is in drunk mode, what he is saying. So that's a big problem, speaking the
Okay, so pausing you there, let me speak to Aftab. Does speech therapy, do these psychological trainings or courses, can they help?
Yeah, exactly. Combination of therapy could work, definitely.
What if, so, I mean, for example, let's take a barber for an example. He's struggling with his speech. So can someone who has that severity of ataxia improve their speech, or is it just going to degenerate?
First of all, doctor teach the patient about what is ataxia.
Yeah.
What is ataxia and what he has to face further damage. When I met him about 3.5 years ago, he was not like that. After some time, his disease become progressive, and right now he feel very difficulty to move, and we could tell as the patient, we could motivate him, we could tell him that he is not only one in the world who is suffering from this disorder. There are a lot of people who is suffering from physical condition, and these kind of things.
Okay, but what type of therapies are there, for example, for somebody who's suffering from ataxia? What type of therapies do you recommend in the first place?
We could do it CBT, like cognitive behavior therapy,
Okay.
because in ataxia, patient also suffering from emotional problems and cognitive functions also, because he's not able to decide the things, he's not able to make decisions, his higher mental process is being suffered. As Dr. Saab told us about main function of the cerebellum is become dysfunction, so that patient also suffering from other disabilities.
Okay,
But before we do that, I just want to move on to Dr. Saab over here. Now, Dr. Saab, what I want to know is that, for example, if somebody is suffering from ataxia and their family wants to take them to a doctor, what would you recommend? They need to go to a neurosurgeon, neurophysician, or a therapist?
Yes, this is a very important question, and because most of the doctors, even public as a whole, and even doctors don't know what is the difference between a neurosurgeon, what neurophysician, a psychiatrist, and psychologist. So these four people are basically concerned with the brain. So neurophysician, he is a physician of the brain.
Yeah.
So he gives diagnosis and treats with medicines.
Okay.
So for the ataxia or like diseases like stroke, epilepsy, and headaches, you have to go to a physician. And if you are diagnosed with a tumor, or you have a head injury or spinal cord injury, then you have to go to a surgeon.
Surgeon, yeah.
So he is the surgeon of the brain. And when to go for psychiatrist? When you have problems with your mind, your thinking, like
Okay, brain.
depression, like negative thoughts, and psychosis, aggressive behavior, then you go for a psychiatrist, and then psychologist when you need counseling.
So basically, ataxia will encompass all of these.
Yes,
Okay,
can be
wonderful.
involved. But initially, most of the time, the diagnosis is done by the
Physician, of course, because that's the first person you should go to.
But
General
combination
physician.
of therapies.
Sorry?
Combination of therapy works more.
Yeah, it's more productive. Fantastic. Okay, with that, we're going to share with you a trailer from The Ataxian. Let's go take a look, and when you come back, we'll continue more about how to manage it, especially for the family and the friends around.
Indeed.
People are just drawn to him, his courage, his charisma.
My name is Kyle Bryant. I have Friedrich's ataxia.
Kyle, the longest stages in the Tour de France, and I know it's just, it's single, it's not a team, but still, the longest stages are about 112 miles. 3 of those per day.
Yeah.
And you got to finish in 9 days. Now, you
In
said 8.5,
this-
so I did the math on 9. And I'll go back and recalculate. You are stronger than I thought.
There are a lot of people in this world that deal with challenges. There are a lot of people who live a life jeopardized by something unfortunate that they never asked for. And there's nothing they could do to change it. And there's something inside me that says, no matter what the issue or concern or disease or dysfunction is, there's a way to fight it, and there's always hope.
It's pouring rain, I'm cold, I'm wet, I can barely see, and if this is what it takes, that's a small price to pay. So we'll get it done.
All right, ladies and gentlemen, that was a small trailer from the movie The Ataxian.
Yes.
And now moving on with our conversation, where I wanted to be in conversation with Haji Babar Sahab, who himself runs an organization to provide awareness about ataxia as well. So let us know about your organization and this initiative we must appreciate you about. I think you've done a great job because of the fact that there are a very smaller number of organizations away in Pakistan who are spreading awareness related to ataxia. So let us know, please.
Very good. After when I diagnosed, I can say I pretty much diagnosed myself. So what I think, but now what I can do, what I can do, because I know I have
To let other people know, yes.
disability after 5 years, 6 years. I have no work then. So then I make a small group for Ataxia patients or Ataxia people in Pakistan. So from the last 5 years, I'm spreading awareness to social media, to print media and your TV media. So people know about this. Before 1 year, just like example like I have 10 patients. I know 10 patients, but I did when I did this program, so more than 50% patients are registered to
now.
me.
Okay.
So that's a good achievement. So in 1 year I make 2 books. I've read down 2 books on Ataxia.
So you've done 2 what on ataxia?
Sorry?
You've done 2 what?
Yeah, 2 books on
2 books.
Ataxia.
Okay.
One book is about fact about Ataxia, and the other book recently I read down about Ataxia.
And then even other than that, for all those viewers who are out there, the amazing thing is that Haji Babar Sahab, with his, in terms of his organization, he hosts these conferences which speak about ataxia and its awareness as well. And I think you're doing a great job, wonderful
Yeah, and you
job.
drive around with your car
Yeah.
raising awareness too, which is
So,
fantastic.
very sadly, last 3 years ago, 3 months back, my car was damaged.
Yeah.
So because I have only this one thing on my car, so my car I do awareness in or awareness.
You've got all the
about
stickers on
all
it.
my door address I write down about
The
door.
initiative is amazing, we must say over here. But
Yeah.
now, what are the challenges which you have to go through just because of the fact that you're running an organization on your own?
Challenges like difficulties.
then difficulty
Problems.
first of all to financial
Challenges are
or
there.
common. And then if the my family is not with me because I'm only living with my wife, my parents are living somewhere different place, so that's the problem because all the time I'm working on this course. Oh, my wife are looking for a children, my children. So my parents should be with me that I need.
You need a
and
support
meet,
system.
Meet
Yeah.
them at a lot of them.
Okay, well, see, that's the thing. This is what I wanted to move on to, which before we shared the trailers, this support system. It's a very difficult illness or disease to live with, number one, and then also to cater for. Now, as Babar has told us, his parents they can't handle it. Now his wife is there; she's trying to support him. What can you say to the caregivers? The people providing the care. How can they keep that mental level of positivity for their spouse or child?
First of all, there is a responsibility of a therapist who bring their loved one to doctor as Babar. They have basic three goals. First of all, therapists should teach the family what is ataxia.
And how to behave accordingly.
Yeah, exactly. What is how to behave and how to control their emotions. Second thing is how to control their emotion because they are human being. They could make mistakes. Actually, the thing is that they are not accepting the fact. They are in denial state because ataxia started suddenly. So that they are not accepting.
People,
Okay.
they prolong it just because of the fact that they're in the denial
There is a
phase,
denial
and then
phase, exactly.
eventually they realize
And the
there's something
third
wrong.
thing is, family should know the problem-solving skills.
Yeah.
How to deal with the patient, how to deal with his own emotions, these kind of things. And in Babar's case, his family is not supporting because even though they could not understand, I have tried many times to tell him about how to deal with your emotions and how to deal with him. But actually they are not supporting.
Okay.
And most of the family in Pakistan,
They don't. Okay, but why? Why do you think that is?
maybe lack of education. There are so many factors. Lack
Okay,
of
But
I
other
would
than
love-
lack of education, Maha, I think what I want to pick up on is
Yeah.
that, for a lot of families, it is even difficult to be there. I mean,
course,
they
okay.
might have their own reasons as well, but all they can do is that they can at least try.
Okay, yeah, well, that's what I wanted to say. Like you said, the family, they too are human beings. They get tired. They have their emotional needs and support. You talked about therapy. Now, for example, Babar has dedicated his life now to raise awareness so other people don't suffer. But at the end of the day, he does have socio-economic responsibilities. People who are less well off, don't have the resources, how are they supposed to afford this therapy and this education and this training and management?
social media is the main thing to support awareness
Okay.
Yeah.
in a lesser cost.
Oh, yes, a very good point. Okay, so that's what you would
Yeah.
advise? Okay, interesting.
Okay, so now, wait,
One-
yeah,
Yes,
sure.
please.
One thing I added that lack of education, that is right. But I am the first in my family. I know all about the Ataxia. From last year, my elder sister, she also built a symptom of Ataxia. Now
Okay.
Oh, gosh.
she's fallen Ataxia. I have we are two brothers and four sisters. So first of all, I'm the
Eldest.
Ataxia patient. Now my eldest sister is Ataxia patient. Last year, Dr. Simia mentioned that if there is a 50% chances if one child is Ataxia patient,
Okay.
if there is a second patient, then there is a 100% the third
Okay.
person also
So it's
patient.
genetic as well.
So 2% family member I am here. So my family should think about the other person.
The likelihood, the possibility that they get it. But that's what we said in the introduction. This lady in America, all her children suffer from it.
Yes.
Now, let's ask you, Dr. Iqbal, you know, we're talking about the support system. I know you're a physician, but what do you advise to people when you meet them who are suffering? Because you know the difficulties that lay ahead.
Yeah.
As for any disease, treatment is usually difficult and expensive.
Yeah.
And prevention is very easy.
Okay.
So
Prevention is better than cure always.
yes, that's all the time. So regarding treatment, they have mentioned the social support, rehabilitation, which includes even the financial support, even from the some organizations or government and family. And with this, they can manage. But for prevention, I must say that regarding the inherited ones, it is transmitted to the next generation. So intermarriages, they have to be avoided. If you know that you are suffering from
inter-cousin marriages,
so you should and before that you can have a test your spouse who is going to be your spouse, you can have tested that.
Okay, so we need to do these things as well.
And the other things, these are for the genetic ones. And for the acquired ones, proper diet, a balanced diet, because deficiency of some vitamins can lead to that. Plus abstinence from alcoholism, that can also prevent. Another cause is the stroke, which can lead to ataxia. So prevention of the stroke, which comes through good control of diabetes, if you have good control of hypertension, avoidance of smoking, and all the proper exercise. So that can lead to prevention of a part of ataxia.
Okay, but as a neurophysician, what I want to know is that it's going to be a very responsible, you know, I have to be very responsible while asking this question, and you have to be very responsible while answering this.
I have to be very responsible listening.
Yeah, and because of the fact that, you know, whenever, for example, somebody comes to you and tells that, you know, I'm suffering from this disease, what is a very fair treatment for all of them out there? Other than exaggerating on what type of therapies we need to do or what not to do, but what is a very fair treatment for ataxia, in short?
It depends on the cause. If the cause is known, then it has to be treated, and it will.
No, but what is that treatment? That's what I'm asking. Because then a lot of times for people who go to neurosurgeons or probably all those therapists who are out there, what happens is that they might not even be able to treat them well as well. So what is a very fair treatment for patients about whom you know that they are suffering from ataxia?
A rough guideline as to what they should do.
Generally, simple thing that all will require is the rehabilitation and support. That is for all. But for specific ones, like maybe some vitamin deficiency, maybe some excess, mineral excess, then treat avoidance of that and provision of that vitamin.
Okay, and one last thing, what are the most common blood tests to check whether you have any type of vitamin deficiency? Can you name any other blood tests?
No, I will not name here, because people will start getting testing.
Yeah, like it'll be a panic.
Thing,
but you're a doctor, right?
Yes, but
unnecessary.
at this forum, I cannot.
Okay, so what you're trying to recommend is that for all those people who are out there, I'm sorry to cut you short over here, but for all those people who are out there, and if there's somebody within the family and he's or she is experiencing from ataxia, what you need to do is that go consult a doctor, get a proper advice, and then do whatever you're supposed to do. Don't follow what we are saying over here. It's just an awareness show.
Yeah, exactly. And also, you know, don't self-diagnose. We've never promoted that. We've always said go to qualified people. But with that, we're going to share a trailer with you. It's called Cake Eaters, and the main protagonist is suffering from ataxia. Let's go take a look. It's 2007, and then when the film, not right now. So go take a look, and when you come back, we'll wrap up the show.
Indeed.
You go to my school?
You go to Lincoln?
No, I work there in the cafeteria. I make your lunch.
You're never gonna get a girl unless you quit that dip beat.
Can I ask your opinion?
Why now?
What are you thinking about, my angel?
Who took those pictures?
Mom.
Well, I like them. What's wrong with you anyway?
I have a neuromuscular disease.
Is that why you talk kind of like you're drunk?
I do?
I mean, no, it's like just slurred.
I get it all the time.
Did you notice anything funny about the way your son was looking at my Georgia today?
Legal? He's got absolutely no game in that area, trust me.
Georgia, what the hell did you do with your hair?
You like it?
Your mama's gonna kill me.
I have a date tonight.
I can't do this anymore.
Do what?
I can't lie to my boys anymore.
He's really nice, Mom.
I'm sure he's nice.
What the hell did I do, huh? Oh.
All right, ladies and gentlemen, that was a small trailer from the movie Cake Eaters, and we just recommend it, so you guys can go out, watch it, probably get a DVD. But thank you very much, guys, for coming over. Thank you very much, Haji Saab. Whatever you are doing, the initiative is superb, and you should keep on doing that as well. Thank you very much, Dr. Saab. Thank you very much, you too as well. But for all those people who are out there, if you're unaware of this disease still, and we made you aware of this fact, please make sure that you go ahead and go outside somewhere, tell your friends about it as well, so that if there's someone who might not even have an idea of what it is, he or she might get that idea and might go to a doctor and consult it with him or her.
Exactly, and also, you know, social media right now is a really good form of finding support. There are people out there who are suffering. It is a very rare illness, you know, something that some people suffer with, and you do need that mental and psychological support.
But we're not going to, you know, wrap up the show at this point because of the fact that it's going to be tomorrow as well. So Chand Raat Mubarak, and may you have the best of Eids.
Yes, and enjoy your family and loved ones and friends, and we will see you very soon.
Inshallah.
So do you log into our Facebook fan page?
Which is with the name of World This Morning.
Our Twitter page.
World This Morning without a G.
Our Daily Motion page.
World This Morning once again.
And the repeat is at?
12:05, don't miss it.
AM, 12:05 AM. I think we get confused, our viewers. So, yeah, we will see you soon.
Indeed. Good morning. Thank you very much.